I think after many of the speakers, after Ursula and Bill and Werner, I would say I endorse everything that they have said and go, but I will say a few words. So I hope you will bear with me if I repeat some of the things they have said. Your Excellency, President Ursula von der Leyen, Bill Gates, co-chair of the Bill and Melinda Gates Foundation, UNICEF Executive Director Catherine Russell, European Investment Bank, and my good friend President Werner Hoyer, Excellencies, esteemed members of the media, dear colleagues and friends. When the Global Polio Eradication Initiative was established in 1988, there were an estimated 350,000 cases a year. I think Bill had described this in a different way as well. So far this year, just 3 cases of wild polio virus have been reported in one area of Pakistan and 6 in one area of Afghanistan. We stand on the threshold of making polio only the second human disease in history to be eradicated. But if we are to do that, we must reach the hardest to reach children in the most marginalized communities. It's therefore an honor to be here today for the announcement of this innovative financing mechanism, which aims to do just that, with 1.1 billion euros in funding for health, including 500 million euros for polio eradication. I thank the European Commission, the European Investment Bank, the Bill and Melinda Gates Foundation, and our sister agency UNICEF for coming together to join in this life-saving project. We can only eradicate polio if we vaccinate each and every child. Children who are unvaccinated or only partially vaccinated typically live in remote areas in communities with little access to health services. This new financing mechanism will allow us to reach those children. This agreement goes beyond polio to deliver vital health services to children in remote and marginalized communities, including measles, vaccines, and other routine immunizations. The new funding will also be used to strengthen health systems to better prepare and respond to emerging health threats with diseases like COVID-19 and Ebola. I again thank our partners for coming together to help build more sustainable and resilient health systems among the world's most vulnerable populations to help us along the path of universal health coverage and health for all, but especially today's main purpose, to eradicate polio. And I join Werner in saying we can end polio. This is the final push, and we can do it, but we should keep pushing. And I would like to join also Bill in appreciating Werner for his leadership as you're wrapping up. And still, I know the passion, your passion in the eradication of polio. Although you're retiring, you will be changing a tire to finish polio. Thank you. Thank you so much.